doamnă și un medic excepțional. Într-un domeniu atât de sensibil, veți înțelege în câteva clipe despre cine e vorba. Nu pierdeți un cuvânt măcar. Tot ce veți auzi este atât de important pentru sănătatea noastră și a copiilor noștri. I'm very happy to have you as my guest. We are talking today about something very sensitive, pediatric oncology. I was asking myself before beginning this interview how I will be able to put you my questions, because it's almost impossible not to be touched by the subject. But first of all, let's talk about you.
I especially studied on tumor suppressor genes.
What does it mean?
It means that in our bodies we have several genes, and some of them function for stopping cancer development in our body. So they are the soldiers who wait at our borders to inhibit the cancer formation in our body.
So they are our friends. We really have to encourage them, isn't it?
And these are very important in pediatric oncology. Because, as you know, cancer is a genetic disease at the cellular level. We have to study on cellular issues to understand how it happens and then how we can stop them. I have only one son. He is 35 years old now, and I love him so much. I have a memory. It was the first and the last that he told me. He was in the elementary school at that year, and he had a high fever. He was having a viral infection, and I had to stay at home for the first time and didn't go to work. And his eyes suddenly brightened when he saw me in the morning just behind his bed, and told me how lucky to be your patient. Always here beside my bed, Mom. And that was a very sensitive memory between my son and me, because he never complained, just the opposite. He respects the work.
You know, in Romania, everywhere in the world, but I'm talking about my country, when a parent is going to the doctor and the diagnosis for his child is cancer, this is like equal with death. It's so hard to hear, and it's so hard to find the strength inside you to fight for your child and even for yourself. Sometimes for the family, it's harder than for the child itself, because maybe they don't understand in early ages, they don't understand so well what is happening, or maybe they are stronger because they have this angel on their shoulders and this positive energy, okay?
To fight against the disease. This is the most difficult time for us, actually. Sometimes the patient comes to you with the diagnosis. Sometimes you have to diagnose the disease. In both conditions, you have to explain what is happening. So, usually I try to talk to mom and dad together.
Saying the truth, first of all,
yes.
Isn't it?
And to separate child in another session, just the parents, the two parents together, and in a silent place that nobody can disturb us, I start at the beginning. I start first and describe what is cancer. It is a disease of a cell. It is the genetic disease of the cell. It happens like this. These cells sometimes lose the control and become bigger and bigger. I take a paper, take a pencil, and draw the cells to them.
So you try to explain as simple as possible.
Yes, and the most important point that I repeat and repeat is this: cancer disease is not equal to death, because like other disease, it can be treated.
In fact, you have to come into this mood. This is the problem. Let's find solutions to fight
Yes.
with it, isn't it?
And
that's
never give up.
and never give up.
Because we have very good results on, especially on pediatric cancers, because they can be treated with surgery, they can be treated with chemotherapy, they are very sensitive to drugs. The new treatment modalities is especially focused on targeted treatment. Targeted treatment means you just go and stop that part of the body.
So you are apply the treatment directly on the tumor side.
cells, not to the other body cells.
Your youngest patient.
My youngest patient. This is also an unbelievable age, because she was prenatally diagnosed.
She was diagnosed inside the belly of the mother.
Yes. And the mother wanted to give birth with that child. The gynecologist, the perinatologist saw the tumor on the lower extremity of the child, and
So important is, look, in this case even more,
Yes.
to do all those analyses in the intrauterine.
intrauterine, and they took the MRI, intrauterine MRI, and detect the disease and inform father and mother. But father and mother told that we want to give birth, we want to give life to this child because God sent us this. We will fight against it.
And what did you do?
And they gave birth. The orthopedic surgeon was ready there. I was there, and gynecologist was there, and pediatric specialist was there.
Because it's a multidisciplinary work.
Yes.
It's very important to work in a team.
The child was otherwise healthy at birth, but the tumor was such big that it was almost about the size of the head of the child. And orthopedic surgeon told us that I have to take this extremity, what we call amputation. I have to make a disarticulation, that is cutting the extremity from the hip.
So the leg?
The leg totally, from here, from the proximal hip, from the hip. I told him that give me for a few days a chance, but always be there to be any urgent surgery. I started chemo, but we didn't go sleep at night, all watching if it is coming burst or not, and the surgeon was ready to cut. And after a few days, she responded chemo very rapidly, and at least the tumor didn't go bigger and bigger, and after some days less than after 2 or 3 weeks, started to decrease in size. And we gave some 5 what we call cures of chemo to this patient. It was very hard. She was a newborn, and we have to be very careful according to the kilogram, the drug doses, and the complications, the infections that we face, the transfusion needs, the other supports. And one thing, I will always remember this family as an idol. They supported their child. They are just 1 hour, 1 day, 2 days, 3 days old child with such a good moral. It was incredible. The mother continued breastfeeding. The tears coming here and milk coming here. But she didn't want anything, any formula feeding. She just gave breastfeeding and tears here, milk here for 8 months in the hospital. And all the pictures of the family around that newborn baby's bed, and just talking as if they are here. I'm your brother. I'm at this age. My name is this. Ayşe, hello, you are doing better today. And I don't forget that child look to me when I come to the room early in the morning, and she tells me that I'm here. I am fighting. I will live my life. And now she is 7 years old. Great. Going to elementary school, speaking Turkish, English, and Arabic. She is very clever. It's really art of my work.
How can I put another question now? It's really hard for me. Your youngest Romanian patient?
No.
Do you remember?
Yes.
Because you have many Romanian patients.
Yes. I remember, of course, it's a girl. It was a girl, just 3 or 4 months old, very young and bright mother and father. They came to me already operated. The tumor was on the scalp, and it was already operated and had the diagnosis of sarcoma. It was very difficult, as I told you, to explain that it's a difficult disease, but it's a treatable disease. We will treat your child, I told the young mother and father, but our way is very long and very difficult. We will do it together.
How old is she now?
She is almost 3 years old now, 3 years old, and I heard her mother that she is also very clever and always asking very good questions about the life and the routine, and she give surprise to the parents to thinking about that kind of things. And she also speaks 3 languages. Her mother told me, the Romanian, the Turkish, and also some English. And she is only 3 years old.
Aș vrea să mulțumesc foarte mult doamnei doctor Inci pentru că a fost alături de noi pe parcursul acestei perioade foarte dificile pentru o familie cu un copil diagnosticat cu cancer. Dumnezeu ne-a dat speranța și ne-a redat viața copilului meu. Vreau să transmit un mesaj tuturor părinților cu asemenea copii. E foarte important la început de drum să ai un doctor, pe cel mai bun doctor, adică poți să mergi oriunde și trebuie să mergi oriunde, să te informezi, să cauți, să discuți cu mulți specialiști, dar să-ți alegi doar unul singur care să fie de la început până la sfârșit alături de tine, să să ai încredere și în tine și în doctor și în Dumnezeu.